In the heart of Nairobi, a city that never slows down, people chase dreams with little rest and heavy pressure. Sleepless nights and growing stress have silently opened the door to a rising medical concern. My name is Suleiman Echesa. As I walked into this story, I wanted to understand what exactly peptic ulcers are and why more and more people are falling victim to it. Nearly half of the patients tested at Mbagathi Hospital had H. pylori infection. This bacteria is the main cause of most peptic ulcers.
My name is Dr. Edwin. I'm the founder and director of Peptic Community Hospital here in Umoja. In our clinic, we encounter so many clients with gastric issues, especially those who are suffering from an aspect of hyperacidity, gas, or rather an aspect of an ulcer. In simple terms, an ulcer it's any irritation or rather a wound on a surface. But now this time, a peptic ulcer disease is a condition where a patient has an ulcer in the stomach. That's either basically before the stomach or rather the middle of the stomach or actually the end part of the stomach. And basically a peptic ulcer disease is caused by overproduction of too much of hydrochloric acid and gastric acid, which causes irritation on the walls of the stomach, and in return, it brings an ulcer formation.
1 in 2 adults presenting with symptoms in Nairobi could be at risk of ulcers. Everyday triggers, from constant stress to excessive alcohol consumption, unhealthy eating habits, to even something as simple as chewing gum on empty stomach, could be one of the leading contributors.
For this peptic ulcer disease, there is no specific cause actually. We just base on attributes, things that will either exacerbate or actually worsen the situation. More so, it's an aspect of extra acid production. There are so many factors as to why this acid will be produced, ranging from diet. If someone is taking a diet that has got too much of acid, it might in return increase acid production in the stomach. An example of beans and basically sukuma wiki, it has got so much content over acid, which now precipitates acid formation and either irritation of the walls. We also have other lifestyle mechanism modification, especially people who smoke and who take alcohol. Alcohol itself is acidic in nature and it's absorbed by the stomach, which now precipitates acid formation. We have a case where we have either a person who has stress levels. Stress levels enhance production of adrenaline, which in tandem also enhances production of too much of hydrochloric acid and gastric acid. We have these people with blood group O positive. They have a higher chance of getting a peptic ulcers. And sometimes we have family history where either the mother or the father of the client, either at one time they also had a peptic ulcer disease. The children will have a very high chance of having ulcers. We have these people who chew miraa and basically who chew gum, the ball gums and the big G formations. Once you chew and you swallow saliva, it also precipitates acid production, which in tandem increases acidity and rather now gets to ulcers.
In a fast-paced city like Nairobi, many people hardly eat balanced meals, and some rely on painkillers just to get through the day. He emphasized the need for timely diagnosis, proper medication, and avoiding self-prescription.
At Peptic Hospital, we provide ultimate care to the patients. First of all, before we expose any client to a medicine, we must first ensure correct diagnosis and actually identification of the disease before we start to give any medication. As well as after diagnosis, we counsel the client, we advise them in terms of adherence and compliance to the medicines, and basically insist that when you're given medicine, take strict concern to ensure you complete all the dosage.
However, not every case ends with tablets and recovery. Some patients develop complications like internal bleeding, requiring emergency surgery and hospital admission.
This ulcer will go to an extent of either bleeding, profuse bleeding, or actually silent bleeding. And mostly with this type of with that ulceration, once it gets to the raw nerve, now it becomes very painful. In terms of emergency, there are clients who come with a bleeding ulcer, of which most of them will be vomiting raw blood and basically passing too much of blood through the stool. This will lead to the deficiency of blood, which results to anemia, and these are fatal disease. So basically, in terms a patient comes with too much pain and they have a frank bleeding, we advise to rush these patients to theater as an emergency for a process for either surgery, either colostomy or surgery to repair the bleeding ulcer.
But there is hope. The doctor outlined treatment options from antibiotics for bacterial causes to antacids and dietary changes.
So basically, we take a stool test to eliminate Helicobacter pylori. But it has little significance because basically having a negative H. pylori doesn't mean this gland does not have peptic ulcer disease. But it becoming positive, we treat for 2 weeks with a medicine called triple therapy that contains a proton pump inhibitor and 2 antibiotics in larger doses taken for 2 weeks. We advise these clients to avoid foods that will excavate or actually precipitate acid formation, the likes of acidic foods, an aspect of spices, taking too much of beans, and actually taking too much of skuma wiki. So we advise them to actually regulate or rather stop the intake. Second thing, we avoid anything that will worsen acid production, an aspect of smoking, alcohol, irregular chewing of gum, and basically something like Mira. In terms of conventional treatment with medicines, we give a class of drugs called proton pump inhibitors. They actually regulate and reduce acid production, and most of them are long-acting. They stay in the walls of the stomach for up to 24 hours. So basically, a client will take this drug once daily. We have an example for omeprazole. We have rabeprazole. We have rabeprazole, and we also have a drug called esomeprazole. So basically, this being a chronic illness, we advise our clients to take these medicines on a regular basis so that to avoid the acid formation.